Now, the reason why I do these videos is normally to explain in a little bit simpler way how does viruses, typically the ones about like the common cold, the more common ones in particular. And the reason why I talk about those is because not everyone gets it, and I'll try to make it a little bit easier to understand by using these pictures and stuff. But I do try my best to focus more factual than entertaining type, because this book was written by written uh, by someone who writes for the news. So all due respect, there is the entertaining parts do make it a little bit easier to read, but there are some nomenclature and vocabulary that it's a little bit hard to understand, and that is why I do these videos, to make it a little bit easier for you guys. So let's just get started. So basically, chapter talks about the story, but then it basically starts off by saying our knowledge about germs is I think we do know better. It's better than, like, let's say medieval times, even like the Stone Age. Like Stone Age, we didn't even know anything about it. So hygiene is a lot better right now than it is in the past, and do tell also even better than the past maybe 10 to 15 years ago, because we not very quite recently knew more about them, how to deal with them. Like, for example, now you'll be seeing these advertisements on medical bottles that you could be taking to make yourself feel better right away, from get relief from the cold, saying that, oh man, if you have too many of these, or sometimes they don't even say true stuff, such as, like, if you have the cold for too long, you're going to, like, if you get colds too often, you have a higher chance of dying at a younger age than most, or something like that. And then they also, of course, emphasize on how evil viruses and even bacterial infections are, and how, like, we should do everything we can to get rid of all of those microbes. Now, not everything said here is necessarily true, and given evidence from Dr. Harley Rothbart, does say that some of these are, lots of these are, like, false. Not all of them actually necessarily are true, and most of it is just for the marketing purposes. So this is just another way for companies to, make money, basically. And so it does put a lot of these medications the same. Not all of them, of course. Like, some of them do. Like, for example, when I'm sick, I take something called zinc, which does definitely help as soon as I get the cold. I did explain in some chapters ago that's it does, like, it was proven to, like, lower the days of me having the cold for a couple days, and but there's stuff like the cough syrup that don't actually work. It just relieves you from the symptom, but it does cause some risk for you. And some of these things are quite ridiculous. Like, for example, they did give the example that there are antibiotic protractors that you can give to your kids. It's supposed to help. And, of course, they jack up the price from a normal protractor to do this. But let's start off by how this is, like, extremely false. For example, antibiotic, and it's supposed to help with the common cold, apparently. Antibiotic, first of all, we do know that antibodies don't do anything for viruses. They are for bacterial infections. So first of all, it's not going to help at all. And second of all, let's say it did, like, let's say it is for bacterial infection, how would these antibodies know where to attack the virus? Because this is for the outside. The kid is not going to, be able to inject, like, the protractor into his, like, veins or into his immune system to go attack the virus. It's just going to be mostly on the skin, and that's not really going to do anything, unless you're trying to, like, make the kid, like, eat the protractor or something like that. But all in all, this is really just marketing purposes, just for companies to make money. Not all of this. Lots of these are just false marketing accusations, really. But yeah. Now, even the idea of the cold is such a not necessarily the cold, sickness is such a psychological um, it's something so psychological that, like, in the University of Michigan, they had this actor they paid to sneeze around people, like he wasn't really sick, but just do like fake sneezes around college students, and then um, they right after they were interviewed and asked about certain questions, and after they did think, like, how would they feel about certain things, even stuff unrelated to sickness. And besides sickness, maybe, for example, they feared that because of that, they're going to have, like, a higher chance of getting a heart attack under the age of 50, or they're going to die from, like, an accident or a murder or something like that. So not all of these are necessarily true, but of course it's just a psychological thing that is given from the virus. So basically, even just thinking about it from your brain does have some negative thoughts, just thinking about the virus for a lot of people. And but of course, right now right now it's a little bit better than it was before, because back in the day, just like I was saying back then, most people, when you're offered a handshake, most people do decline, mostly because they are smart enough. Most people who are sick conscious, basically being conscious of the sickness, or just in general cautious of being sick, do know that it's not a good idea to, necessarily donate your viruses to someone else, which is a lot better than it was before. Before, people were just like, wouldn't even care, and it would be like spreading, and we never know that it was such a dangerous virus as it rapidly spreads. Now, also for children, necessarily, like, of course, okay, so if your, like, kid is if you're worried about your kid, maybe you want him to have, like, put on some hand sanitizer before playing with his friends, even though his friends aren't sick, but you don't want to worry about any risk. Now, these are just things that don't seem necessarily smart to do, because, like I was talking before, kids should get the sickness so they can build up their immune system, but also, I mean, it's just so unnecessary to do something like this, to, just make people not be allowed to hang out with friends just because of, just because you're worried about them getting sick. Now, if it's like flu season and you have, like, this together thing where there's a lot of hands and touching for kids, of course, then yes, that would be a smart thing to, put some hand sanitizer on, or, like, take a little bit of medicine, but you don't need to go all out, because of course they still need to build up their immune systems. But if it's like during flu season, then of course, like, you know, it might be a good idea to protect your kids' immune systems that way. Now, while talking about sickness, I did draw most of the people as wearing a mask. Now, for masks, they don't actually necessarily help much. Now, let me clarify on that. So, okay, it's already hard enough for, like, kids to even put on masks when they're sick, but all in all, the virus through the face has so many ways it can get into your system. Okay, it covers your mouth and it covers your nose. Sure, that's fine, but it doesn't cover your eyes or ears, or, like, let's say you have a cut wound or something like that. The virus can still get in. So unless it's covering these certain places, it's not necessarily going to be much of help. It won't necessarily be much of help, because these viruses can still get in, and they can still do their business, whatever they did. Now, one interesting fact that they were talking about in the book, and this could be possibly just for marketing, but just the idea of masks in, for example, Asian countries is a little bit more common, that they would go, that, for example, apparently they did build this bra that, for emergency purposes, can turn into 2 masks. And now, of course, lots of people might actually like this idea. I'm not too sure why, but but it's not necessarily a bad idea. But what I'm saying is, these masks don't necessarily help as much as as much as people think. Like, just because you have a mask doesn't mean you're, like, immune to having immune from getting any sickness whatsoever. Like, there's still a pretty dang high chance for you to get sick from this. So yeah. But according to Dr. Larson, also given from the book, she did give two very important advice for not catching the common cold. Now there are two that you can think of. Of course, there's the obvious one. Maybe be a hermit, never talk to anyone ever again. Then okay, yeah, then you're not gonna get the common cold. But or two, just avoid children in general. Now we know both of these are not very likely possibilities. So the things that you should do to live out your life and be a normal person is just constantly wash your hands very much, and do not touch your face, because that's how the virus gets in. It's the most vulnerable part, unless you have like a certain cut or something like that. But touching your face, because again it goes from the eyes, nose, mouth, etc. And this doesn't seem very hard, but it is. Especially touching the face is one of the hardest habits to break, because even people who work on a computer, they will touch their hands on average 200 to 600 times a day. Now this is a very hard habit to break, and that's why we wash our hands, because when you wash your hands, at least you have a less chance of having like stuff on your hands to get you sick from touching your eyes or nose, because those are the most important ones, your eyes and nose. So yeah. Now, ending on a note, now you might be wondering who was the first person to actually realize, this is such a important thing to keep such good hygiene to not spread any diseases. Well, in 19th century Vienna, there's this doctor named Ignaz Semmelweis who was delivering babies sometime then. And the problem was when he was helping deliver these babies, there were mothers who were dying in their beds within 24 hours of giving birth. And when I just say a couple mothers, I mean 1/3 of all of the patients there were dying within 24 hours of giving birth to their baby. So you can probably tell there's a lot of women who are pregnant who wouldn't necessarily want to get their child born in the hospital, because they're a little bit worried for their own sake. Of course, they're babies as well, but they're also for their own sake, and they're just worrying about that. And and basically everyone was really, really worried about it, because no one really knew how this how is this disease going from person to person. Well, what Semmelweis did figure out was it was really the fault of the doctors and the med students there. Now, why is that? Because after dealing with the dead and getting rid of them, they were still dealing with their hands without washing it very well and dealing it with their next patient. So basically, they were quite literally passing on the virus from person to person with their hands. And he described it as this morbid poison, probably because of the unwashed hands. That probably included the virus. It does not say specifically, but this is probably the culprit of it. Now, this kind of made Semmelweis go into a panic mode, because he realized how many people have been dying just for some dumb thing of people just not washing their hands. And so, of course, he was freaking out, because he was calling people murderers and medical neros, basically two very big insults to anybody. And so he was calling these to the med faculty, and so eventually had to lose his license, and eventually, when he was growing old, did go into a mental hospital and died for an unfortunate event. But he is still very well known for being a hero right now, because without his thinking, most likely most of us would not be here, and there would be a lot more deaths just in the hospital, just because people aren't washing their hands very correctly, and no one would even know. So yeah. But to recap, people do really need to wash their hands. It is one of the most important things to do, especially when dealing, if it's like flu season or something like that, and you have a virus or someone else has a virus. It's very crucial for them to wash their hands. Now, most people nowadays don't even do it, mostly because they're too lazy. I mean, it's such a hassle just to wash your hands. Most people are thinking about it. Most people will be like, oh, it's fine. Maybe I can just like splash some water, flick it off. That's technically not enough. And it could only take 15 to 20 seconds if you're doing it right. That's all you need. And please make sure that you don't. One very important thing that they said is when you're scrubbing, don't scrub too hard because you could damage the skin and then viruses could get in even easier. And we wouldn't want that. So just scrubbing the surface in between your fingers and any jewelry you have in your hands is just enough to get rid of this virus. And yeah, that's basically about it. I hope you did like this video, and I will see you next time. Thank you, and bye-bye.